You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veatch. I'm your host, and in this series we'll be discussing topics of interest for those who are caring for loved ones with dementia. We invite you to subscribe to the channel, and we hope that you'll hit that thumbs up like button. Both of those actions help our channel to grow and reach more people. And if you'll hit that notification bell, you'll be notified each time we upload a new video. Our guest today is Dr. Kendra McAlear. She is a speech pathologist. She has a master's in communication science and disorders from the University of Texas. She has a doctorate of clinical science from the University of Pittsburgh, specializing in medical speech pathology. Now I need your help.
You.
and about 25 years as a speech pathologist. Thank you so much for being with us today.
Oh, it's absolutely my pleasure.
And we should also say that we are taping this at the Rocky Mountain Alzheimer's Summit in Cheyenne during the month of May 2022. Speech pathology and dementia patients. When I first think of that, I think that seems like an odd combination, an odd relationship. Do you get that a lot? Do you ever get that?
All the time. I think speech pathologists suffer from a massive PR problem because nobody seems to know what we do, and our title doesn't quite capture it all. So most people think of a speech pathologist as somebody who teaches little kids how to say their R's and their L's. And there are plenty of speech pathologists who do that, absolutely. But with adults, in a medical setting, there are about 4 different hats that we wear. The first one is speech problems. So if you've ever known anybody who's had a stroke or Parkinson's disease or a brain injury, speech problems can result from that, and we can certainly work with retraining the muscles to try to speak more clearly. We also, as our title indicates, deal with language problems, which is different. Speech is how all the muscles work and coordinate and do what they need to do to produce speech. Language is in a different part of the brain, and it's the thoughts and the content of what comes out of your mouth. So I could say something very clearly that's absolute gibberish, and as long as it was clear and you could understand every sound, there's nothing wrong with my speech, but there might be something very wrong with my language. And language problems are most commonly seen in dementia and brain injuries. And stroke. Third thing that we deal with is swallowing, because all of the same muscles you talk with are all of the same muscles you swallow with. And swallowing is a problem in many, many, many different disorders, including later stages of dementia. And encompasses not just getting things to go down, but also drooling is something that I deal with a lot. Parkinson's patients in particular complain about, I just can't keep my saliva in my mouth. I've got a brain injured patient right now. We're working on that, so I can do that. And then the fourth thing, which is perhaps most pertinent to the dementia discussion, is cognition. And cognition encompasses several different domains. Attention, focus, concentration, being able to keep your brain on something long enough to do what you need to do. Memory, of course. Problem solving, reasoning, judgment, all of those are parts of cognition. And the reason that is part of the speech pathologist's field of practice is because language and cognition are so closely tied together. It's actually really hard to separate them sometimes. You can't speak a coherent thought if you don't have a coherent thought. So that's kind of how we fit into the puzzle.
How does the relationship with the dementia patient begin? Is it the family that approaches you, or do you get referrals, or how's the connection made?
It's we are a referral-based specialty. So unlike PT, which now you can go seek out a PT if you're having a physical problem and just go to them and say, hey, I need your help. You have to have a doctor's referral for speech pathology to get to be brought into the picture. And sometimes doctors identify there's some memory problems, or maybe they already have a diagnosis of dementia, but very often what happens is we get a referral after somebody's been in the hospital and they've broken a hip or something, and the PT in the hospital might notice that they're not really getting what I'm telling them they need to do. Can you maybe come in? So we can A doctor has to sign off on it, but other healthcare professionals can make the referral. So a lot of times PT or OT are the ones, when they've been working with somebody for a little while, or a nurse, and they say, yeah, Mrs. Smith really just doesn't seem to be getting this. Can you check out her her cognition? And then we go from there.
What about dealing with the family members? Do you have to ever do some convincing that their loved one needs this or could benefit from speech therapy?
Often, yes. And it's not that they don't recognize the problem. A lot of time the family will recognize, oh yeah, well, they can't quite remember the word every time when they want something, but it's not that big a deal. They try to minimize it. Sometimes they don't recognize it at all, but I really think on a subliminal level, when you know somebody well, you know when something's not quite right. I think it's an issue of wanting to accept what this might be. Dementia is a big, bad, dirty word, and it has a lot of stigma associated with it, and I think people are afraid. I think there's a lot of fear around it. They don't understand that getting a diagnosis of dementia doesn't have to be a devastating, life-altering, my life will never be the same kind of thing. We go through changes in our life all the time.
Yeah.
We slow down a little bit, we dislocate a shoulder, our vision changes, we don't get all strung out about that. So granted, dementia is a little bit more than your vision changing, but it doesn't have to be as bad as everybody thinks it is. And right now, everybody thinks this is the worst thing you can ever have happen to you. So I think there's a lot of denial. I think people don't want to admit and get that diagnosis because it's scary.
If I have a speech problem and I come to you, it's a one-on-one professional relationship. When you deal with someone with dementia, you have the family involved also. Does that make it a little tricky to navigate sometimes?
It can, but it's absolutely crucial that they be there. The person with dementia is going to need a lot of support as the disease progresses. And the hardest cases that I have are people that don't have anybody to support them. Yeah, because who's going to remind them to take their medicine? Who's going to, help them figure out of the 13 pill bottles they've got, which ones are which and what time? Who's going to remind them to eat? Who's going to, people with dementia need support, and they need people that aren't afraid to jump in and provide that support. But on the other hand, a lot of times I think families don't want me to think poorly of their loved one, and so they try to minimize, even as they recognize there's something wrong. If I do some testing, what I hear all the time after the testing is, well, that was really hard, I probably couldn't have answered a whole bunch of those. And I think, yes, you really could have, but I think they don't want me to think ill of the person that they love and care about. And so sometimes they'll try to answer for them, which is not helpful. I really need to see what's going on so I understand how best to help this person.
You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. If you haven't done so already, we hope that you'll subscribe to the channel. If you see that thumbs up like button down below, if you hit that, it'll help our channel to grow and allow us to reach more people. And then also, if you'll tap that notification bell, you'll be notified each time that we upload a new video, and we thank you for doing those things. I would think that one of the challenges a speech pathologist would have in dealing with a dementia patient is monitoring or assessing your progress, because when we talk about dementia, people with dementia, it's not a situation where things get better.
Correct. So there's two main things that any rehab therapist does. There's rehab, which is making something better, trying to get back as close to before as possible. But rehab's not always a possible goal, such as with a degenerative condition like dementia. So the other kind of thing we do is compensation, putting compensatory things into place to help compensate for the things that can't be rehabbed. So I don't really measure.
So that involves working with the family too.
Absolutely, it does. My hardest cases are trying to figure out how to help somebody with dementia that doesn't have any close family or friends supports around them, because those are the people that are absolutely crucial to making this all work. The person with dementia is going to start having more and more trouble doing things that they normally could do for themselves, and they're going to need a lot of social support from family and friends to make that happen.
No, go ahead.
So the testing, measuring progress, I don't measure patient's progress per se. I measure how well a situation is being managed. So I might go in and test them at first to see where the gaps are, or where they're having difficulty in their thinking, which cognitive areas are more lacking or relatively still well preserved. But then I look at that in the context of what do they have to do to get through a day? Do they make phone calls? Do they use the computer? Do they have to manage appointments? Do they have a lot of medications? And I look at all the different things that play into what a day of theirs looks like. And then I look at what areas are they needing help with, and then how do we find some sort of help, whether it's alarms or whether it's a person that they rely on for something, or whether it's, certain types of pill boxes or whatever, to help them make sure that each of those things they have to do in their day gets done successfully.
If you're a person who's a loved one, someone has dementia, are there some red flags, some things that might be a tip-off that the person that you're caring for could benefit from speech path?
Certainly, memory loss is a big telltale sign, and a little bit of memory loss as we age is normal. I have a little memory loss. I forget where I put things sometimes, or you search for a word sometimes. But there comes a point, which I think most people recognize, where it's happening a little more frequently than you notice in other people the same age, or in yourself, or it's a little more pronounced. So memory loss can be one thing. Another one is difficulty completing tasks that they used to be able to do well. Sometimes it's not usually a motor problem. It's not usually a problem of their hands don't work right anymore. If it's more a problem of they can't remember the steps, or you tell them something new and they're not quite getting the gist of it where they would have been able to do that, those are some red flags.
I think one of the things, and I think back now to my own experience with my wife, she began substituting words for another word. She liked to cook, and she began calling English muffins Irish muffins, things like that. And I think as I look back, I think I may have missed it. I think that there's simply, and this is maybe 10 years ago, so I think that I might have, that maybe the services weren't available that are available today. Are we making progress? Are we farther along than what we were 10 years ago, 20 years ago?
Yes, we are, but it's constantly a work in progress. The research is better. There's more funding now. There's more research being carried out. As the population ages, too, I think more healthcare practitioners are seeing that we need to be putting some of our efforts into providing good care and treatment for that aging population. I also think that just our knowledge and understanding of how to work with people with dementia has improved. We used to, years ago, believe in reality orientation. So if they thought it was 1987, no, it's not. And we would correct them because we wanted them to get it right. And we know now that that's a supremely bad idea. You don't do that anymore. Mm-hmm. Right. And as that information gets out there, I think more practitioners are understanding some better approaches to helping people with dementia. But we do still face a lot of challenges in rural communities, in sparsely populated states like Wyoming. It can be challenging to find people who can deliver the services that you need.
Is geography the problem? As far as reaching people in rural areas, I mean, is that it, or is it, because I think there is technology where things are available, information is available online, but I guess that really doesn't help when you need the one-on-one contact with someone.
Well, there is that. I mean, I feel like I provide the best services when I can get into the home and observe and see how things are laid out, what's going on, what is it.
Do you usually do the work in the home or in your office? Really, in the home?
Oh yeah, absolutely. Yeah, that's where I can do my best work. But keep in mind too, the population we're dealing with is often over 70 and didn't grow up with a lot of this technology. Now, that's not to say that plenty of people over 70 don't know how to use a computer or a smartphone, but a lot of them don't. And there's not good internet in a lot of these places. So this is just my feeling, but I think geography in Wyoming, I think geography is one of our biggest hurdles.
Where do you see, ideally, in an ideal world, where would we be 10 years from now?
In terms of dementia care?
Yeah.
So this is my pie in the sky.
Absolutely. Take your best shot.
I would love, so let me back up. Everybody here at this conference that we're at right now knows how to read a calendar. Now, did somebody specifically sit down with them with a calendar and go, okay, this is a grid and this represents a day and here's the audio? Nobody did that. It's just something you kind of absorb as you grow up, and it doesn't matter what kind of household you grew up in or what, era you grew up in. Everybody knows how to read a calendar. Not everybody knows how to help or talk to somebody with dementia. And my pie in the sky view would be that just as a society, we get so good at this, that it's just something we absorb. We see so many people who don't get shuttered in their homes and pushed away in the closet, who are out and about in the community enjoying life as fully as they are able, at whatever level they are able, and a community that supports that and knows how to talk with them and knows how to support them, so that the whole community is there to help the community members with dementia.
Pretty tough to come up with a person who doesn't know someone with dementia.
Absolutely.
Yeah.
So why aren't we better at this? We've got to get better at this.
Well, one of the things I think that you are doing, that you mentioned to me before we began, is you're involved in private practice. Tell us a little bit about that.
So it's been something I've been working on, just little baby steps here and there for the last couple of years. When the pandemic hit, I was laid off from my home health job. Because because the home health agency that I worked for at the time, which was in another state, specialized in assisted living facilities. So it wasn't individual houses that I was going to, and those assisted living facilities closed down unless you had like a life-threatening sort of injury, or if you just had heart surgery and you had to have a little physical rehab. They might let the PT in for a limited time, but rehab therapists couldn't hardly get in, and so there wasn't the work. The work dried up during the pandemic, and so I was laid off, and so my husband encouraged me to look into private practice maybe, and I started doing a little looking and reading and talked to a couple of people I know, and so I've got a few things set up to that end.
Is it off the ground?
It's sort of not quite yet. I'm not set up to bill for insurance. The Medicare insurance manual is hundreds of pages, and I do have a day job, and I work, so I haven't had a lot of time to delve into that. But I do have a business plan set up by an attorney, and I've got business cards, I've got an accountant, and I've got knowledge.
Our contact information is going to be available in the dialogue box below. So
I've got the knowledge, and I'm willing to share it with anybody who wants it. So
we're coming to the end. Anything that we should have touched on and didn't get a chance to?
I would just say, don't be afraid of a dementia diagnosis. It can be a big, scary word. Nobody wants to hear it, but the longer you resist it and delay getting services for yourself or for somebody who needs them, the harder it is to get the right things into place. Early detection is absolutely key.
We have been talking with Dr. Kendra McAlear. She has a doctorate of clinical science from the University of Pittsburgh, specializing in medical speech pathology. 25 years as a speech pathologist, so the lady knows her stuff. Thanks so much for being with us.
Thank you. I really enjoyed it. Nice talking with you.
Perfect.
we
Thank
go.
you so much.
Great.
You've been watching once again a YouTube video presentation of the University of Wyoming Center on Aging. We invite you to subscribe to our channel. We hope that you'll hit that thumbs up like button. Those actions will help our channel to grow and reach more people. And if you'll tap that notification bell, you'll be notified automatically each time we upload a new video. I'm Scott Veatch. Thanks so much for being with us. We'll see you again next time.